Hello guys, it's Naim Pradhan over here, and after some quite long months break, I'm here. Okay, so I will discuss today the same topic. Okay, after my last message that I wanted to state to the people and the people who take actions based on the protest or the findings of the events and scenarios, so they took a lot of actions, and we are happy for that in my country, Bangladesh. Okay, so the next thing I tell you something, that is, I just explain you something related to the same things. Okay, now I come step by step. You consider the thing that the hospital mind care was shut down because of the fact that someone prescribed, like forwarded the patient to the hospital. There is not a correct thing. If you have the facility to treat the patient, you don't need to forward to somewhere, number one. And with this event, I will suggest that we need to create some laws which are pretty similar to the HIPPA Act, which is present in the US. Okay, so I tell you that once the patient is in that mind care hospital, you see in the YouTube videos that he was attacked by a group of people, right? And that those people are not that much expert that the way they try to tie the guy is not a proper way. You see, the head was very much pain and he couldn't even breathe. Within 2-3 minutes he died. Okay, I consulted with the doctor and he told me the story that because of the position of his head with his body, he couldn't breathe and he was died within 2 minutes. So you see, previously I told you that the kidnaps which they do to treat a patient because he's a drug abuse patient, they're doing with the private people. There's no guidelines how to recruit those people. And this is the result which we see, that they don't have any training how to treat those people and how to calm down the violence that patient is doing that moment, right? That's why he lost his life. Second, for example, you keep the patient in a controlled environment, right? So in that controlled environment, how come a patient suicide, right? The parents give their son or daughter to the hospital that because they cannot control in their house. So they know that there may be a try to make a suicide attempt. And in your place, if he or she dies by a suicide, how it looks is a complete failure of the system in which places it happens previously. So 2 points is here. One is we need trained staffs who can treat such patients. Number 2 is you need proper facilities. Okay. Next is the charging, the fees. For example, you are a great counselor, for example, or a big doctor. You take 1,500 for 20-minute session. In other place, someone is taking only 800 for 20-minute session. Someone is taking 1,500 for 1 hour session. And some people is taking 1,500 for half an hour session. So each of them are graduate in psychology or they have experience. But why this much difference? Like if you talk 10 minutes, he's giving 1,500 taka, right? So, and when in your clinic itself, people dies in suicide. So you can tell that is a type of business nowadays, right? So we have to make some guideline that you recruit proper people, and when you kidnap, you bring with the legal people, because previously it is seen that not in every case, but in some of the cases there is abuse out there. Like they create, for example, there's a property related issues out there. So the guy who is weaker in that family, he gets abused by the other members of that family because he has some fault, and in this country there is a law that if there's someone abuse, you can do that, right? So if you do that, you must have some support for that person at the moment when you do the kidnap. Otherwise, people are abusing this. Without the presence of that law, people are abusing. Next, so we need such type of law for the financial stability, synchronization throughout the country. We need better staffs. We don't want that in the patient dies in the clinic, right? Next is, for example, in your clinic, someone is have some dental tooth problem, right? Now, he has only prescribed doctor, he has to go there, must be there. You cannot tell that there is a separate facility. You can tell that you have to go there. You cannot tell that you have to eat in this restaurant. You have to go to this particular diagnosis center. You must go to that particular doctor. So this is the violations. A long time is going on. It turned into a business. For that reason, there are several top quality doctors. People want to go there, and there is there has compounders and other people who people bribe to get the appointment. So what is this? So if you make the standard pricing for consultation, they won't get that chance because he takes the same money. Similar quality doctor, but he has more branding. He's getting the list gets longer, so no actual outcome because the people get to do corruption. These doctors are getting bribed from the companies who provide the services of healthcare. The pharmaceutical companies, if they prescribe their medicine, they are getting better sale. So they send the promotion officer to convince those doctors. And doctors is connected with the diagnosis centers. This is how a bit corruption out there. And so we need some law which will protect the patient to not expense more than required. And as well, patient safety is out there. Based on the treatment process, they cannot abuse and use it in other function. For example, when someone is going to a doctor with mental illness, if they provide a certificate, he loses his job. Then to avoid that, he will send them to the private company, so that clinic, so that they don't give that certificate. So it's a complete evidence that there is some gap out there to save that patient. Rather, it should be told that I give you certificate. As well, I write that your employer should know that this guy had problem, but he has that much capacity to work over there. So I give you the correct certificate. Together with that, he is correct now. And here, what is they are doing, because it's a government job, he may lose the job. So we need a more precise employer guidelines also from employer side, but from the doctor side, they can never put a false certificate. I saw some cases that they have cases. For example, they have some violence in the public. He has a crime. He did a crime. Now to show that person not in good proper state, they keep him 10 months. Then provide certificate that he's not in good mental health. So he did it. So we keep them 10 months. He's punished already. So these type of things people are doing there. This is abuse that they do. But real proper treatment is also there. But for example, if there is 70% proper treatment, 30% is gap there. So if we can fix such gaps in our law, the problem will be resolved. It's not for particular one person, which happened previously. If we fix the law, find out the gaps, put some material so that they can overcome the gaps, so people get better service. So this is what I wanted to tell, that last time when that important police officer was killed in a hospital, the hospital is closed. Or in other place where a patient was suicide, there is no punishment out there. So we need something that to take action by the authority. If big events happen, brutal events happen, then they take action. But if we make the law now, based on the current incident, previous evidence-based data, we can make sure that if we keep the gap completely off, they cannot do it again. For that, we need to make proper standard fees for the consultations of the doctors, because the doctor said they take the money, right? Whatever the big clinics or hospitals that are. Okay, so my question is, my statement, I want to tell that we need some act just like say HIPPA, so that you cannot forward a patient to another clinic, get some money from there. You cannot prescribe a company medicine, you get money from there. You can put some patient to the diagnosis center, get money from there. You cannot kidnap anybody with proper evidence and based on only father's or mother or relatives' statements. Rather, lawyers should be there in both parties. Police should be there. human rights association workers should be there so that he can tell something. And after that, if it is proved that there is a mental issues out there, then you take them there, right? So these things happen in our country. It's happening. Well, but I really praise our government that they really took action in many of the cases previously, and I thank them for their previous actions. And now I want to point it out to our government that there are some gaps out there, and I strongly can provide you some evidence that, and you know already that there are different prices for consultation, right? And we know that the doctor prescribes that you go to that diagnosis center, you go to that clinic. And the last thing which happened with the police officer who was killed in a Mindcare hospital, he was prescribed from one guy to go there. So these are not correct things. We need a reform in our laws, and we need to create new laws to stop such type of violence. These are bigger than a lot of police violence or any other type of violence. So we should take care of this. Thank you very much. Bye.